Hi, I'm Dr. Kurt Woeller for the Clostridia Mastery Course. Clostridia, we know, is a problematic infection for many people, particularly with regards to bowel disease. So Clostridium difficile diarrhea is certainly problematic. And then the more troublesome pseudomembranous colitis can actually be lethal. So here in the United States, there's hundreds of thousands of people that are hospitalized every year because of Clostridia difficile infections. And thousands of people unfortunately die. And in fact, if you look at the Centers for Disease Control statistics annually, we're upwards probably around 13,000 people per year. Now, of course, there's other types of Clostridium or Clostridia infections like tetanus, for example, or botulism. But primarily, most people who are dealing with Clostridium infections is at least what's recognized from conventional medicine is the Clostridium difficile digestive system disease. Now, there are many more people who are struggling with Clostridia problems who don't have any evidence of digestive system problems. We think of Clostridium difficile as just one type of bacteria, but there's many different types of Clostridium difficile. Not all of them produce the toxins that adversely affect the gut. In fact, some Clostridia difficile produce another compound called 4-creosol, which interferes with the brain and nervous system. Other types of Clostridia bacteria produce a compound called HPHPA, and this too interferes with the nervous system. In fact, HPHPA and 4-creosol specifically inhibit an enzyme called dopamine beta hydroxylase, which interferes with the conversion of dopamine to norepinephrine. And in severe cases, that can actually be linked to dysautonomia, for example, very commonly seen in causing behavioral problems and autism. Certain people with mental health problems often have high levels of these particular compounds that again can contribute to many of their issues. Certain neurodegenerative conditions like Parkinson's disease, many of these people often have high levels of 4-creosol and or HPHPA. And so the discussion about Clostridia goes well beyond the gut. Now, certainly in this particular course, we focus a lot on what's happening in the digestive tract, particularly with Clostridium difficile and its association with bowel disease. And so we do a deep dive into that discussion, and we touch on some of the other pathogenicity mechanisms of Clostridia infections as well. And we even talk about some of the beneficial roles of certain types of Clostridia bacteria. We also go into great detail into the effects of Clostridia organic acid toxins, as I just mentioned, HPHPA, 4-creosol, and others, and their negative influence on the brain and nervous system. And newer information is emerging now about the adverse effects of Clostridia on mitochondrial function and how that plays into different types of health conditions, including autism, again, mental health, neurological problems, etc. We also explore aspects of the immune system, looking at innate immune function, crossing over to adaptive immunity, particularly with regards to mucosal immunity, and what the mucosal immune system is doing in trying to protect the body against the toxic influence of Clostridia. What is the microbiome doing in this discussion as well? Because that also plays a significant role. And then we get into aspects of the relationship between Clostridia and Candida. And then other factors, specifically looking at Clostridia toxins or the presence of Clostridia interfering with fatty acid metabolism and some of the downstream effects of that. So there's a lot that is discussed within this very in-depth course. We get into laboratory testing, and then we also get into aspects of intervention, talking about different strategies for Clostridia eradication, microbiome diversity, improving the microbiome status, looking at improving immune function as a defense against particularly recurrent Clostridia, which is quite problematic and very common. We'll look at antibiotics, botanicals, other supplements, other strategies, again, for Clostridia intervention. And so if you are a healthcare practitioner in the world of functional integrated medicine, or if you're just looking to improve your knowledge base on the aspects of Clostridia problems beyond just C. difficile induced bowel disease, this course is going to be very, very comprehensive. And so take a look at the information on the homepage of the Clostridia Mastery Course. If you have questions about the course material, you can please reach out to us with questions. And I look forward to assisting you with this information through this very important topic. So again, I'm Dr. Kurt Woeller for the Clostridia Mastery Course. Thank you.